If you are looking at surgery in your future, I'm sure you're a little anxious about it, and you want a positive outcome. Who doesn't? But does that surgery need to be in a hospital operating room, or would it be better for you as the patient to look into an ambulatory surgery center? Joining me is Dr. Herb Riemenschneider from Riverside Urology and Knightsbridge Surgery Center. He's also an instructor at Riverside Hospital and OSU Medical Center. You are a busy man, doctor, and welcome.
Well, thank you, Gail. It's a privilege to be here.
Good, good. Well, let's talk with what the meaning is of an ambulatory surgery center to folks who aren't familiar with that.
Ambulatory surgery center, Gail, is an operating environment that is for patients that really doesn't have the rest of the hospital attached to it. We meet all the same standards that the operating room of any hospital meets. We're reviewed by the same organizations. And the real benefit is that we're much more streamlined and focused at certain levels of care. Now, tertiary, a very complex surgery, is not done at surgery centers, but lesser surgery is done. It's done at less time. The patients find it to be very convenient, and the cost is less.
Is this outpatient only that we're talking about, doctor?
Ambulatory surgery centers, you walk in, you walk out, and you recover at home in a very comfortable manner.
And that's the good part about the walking in and walking out in the time. We were talking earlier about one of your patient's experiences. Explain to the folks that story about the woman who had an issue with a stone disease and how it helped her.
Well, we were talking about kidney stones, and we received a call in our office, and our office happens to be in the same building with the surgery center. And the question was, could we help? And we said, of course. Now, this person had been in the emergency waiting facility for about 2 hours.
So they were already there.
And we said, come on over. We took a look. We confirmed the problem. I knew it would be a relatively routine procedure that's very well adapted to the surgery center. The patient came, was treated, was discharged to home in comfort, no stone, in less time they'd been waiting in the ER.
Yeah, that is sometimes frustration on parents' part, is the patient's part, is the waiting and all those things that go with it. But the question is, do patients often have a choice? Do they have to sometimes do a hospital surgery center, or can they go to an ambulatory center?
Well, there's no question that hospitals, emergency rooms are very necessary for every community. But the facts of the matter are most of the surgeries in this country are done electively, and for elective surgery, patients, for the most part, do have a choice. And again, there are certain levels of surgery that aren't appropriate at a surgery center, but let me make this point. 70% of the surgery in this country could be done in ambulatory surgery environments. And if they were done, for instance, at a facility such as Knightsbridge, the cost would be 2/3 of what it is in hospitals.
Wow. That's something to look forward for the entire health services for our country.
Well, for health reform, this is a key issue, and nobody's even talking about it.
Mm-hmm. You work with men and bladder control issues. We discussed that earlier on Daytime. Would somebody be able to go into your surgery center for one of those types of surgeries?
Well, absolutely, and incontinence is huge. It doesn't just affect men, it affects women
True.
too. And the treatments that are available, that are surgical treatments, are very applicable in surgery centers. There are things such as slings, there's sphincter devices, there's many treatments that we can welcome the patient at the surgery center with their problem, send them home without it. They're comfortable recovering at home.
And you also mentioned newer vasectomies that are easier to do, outpatient.
Well, vasectomy has been a procedure's been around for a very long time, but it's undergone reinvention. Minimally invasive space-age technology, no needles, no scalpels, no pain, 15 minutes, and the patient has assured their family plan as they walk out the door.
Everybody will know the plan is. Dr. Riemenschneider, thank you so much. And I know there are folks that may want to get a hold of you, so we have your phone number up there for people who want to get a hold of you and learn more about Riverside Urology. Thank you.
Thank you so much for the opportunity, Gail.